Hi, this is the host of Tech Talk with Craig Peterson, heard weekly on Clear Channel Radio with another Tech Searchlight. Welcome back to Tech Talk with Craig Peterson. We're talking about some of the latest technologies that are available to all of us and things that help to make our lives a little bit better. Right now, we're going to talk about a company that's striving to put the care back into healthcare. They're taking some of the world-class technologies and services that are really designed to help make individuals proactive and help them with their healthy living choices and move it into kind of the real world here for all of us. We're going to talk a little bit about the available technology that allows seniors to age in place so that they can be a little more independent for longer, as well as more here with Alex Go. He's their CEO. Again, virtualhealth.com is where you can follow along at home. Alex, welcome to Tech Talk with Craig Peterson.
Good morning, Craig.
So let's talk about what you guys are doing over there. We have an aging population. Everybody needs health care, at least from time to time. What's virtual health all about?
That's exactly right. What we're here to do is fulfill a need for family caregivers as well as seniors that desire to stay in place and age in place at home. And so what we offer is a subscription-based opportunity for family caregivers or seniors to subscribe to our network of professional caregivers as well as the combination of technology in order to enable a senior to basically be at home, monitor the blood pressure, weight scale, us executing to their physician orders. We also offer a very holistic approach, so it's not just about the health and wellness, it's also about care coordination. So we know and realize that many caregivers are remotely caring for their loved ones, like their parents, and also activities of daily living services, meals, transportation, even medication refill services are types of services that we would be offering as well. And last but certainly not least are financial services. We believe that we need to deliver the virtual assisted living experience to the home. And what do seniors care about? They care about their health. They care about how are they going to get around, the type of foods that they'll be eating from a nutrition. And last but certainly not least, how long is their nest egg going to last?
Yeah, that's true. The financial part is one that's often overlooked by so many people. So you're trying to provide now online here tools, some of the technology to be able to do those things. So I assume too that peace of mind, it isn't just for the aging, but it's also for their families who are concerned about them and would like to know about the health and welfare as time goes on.
That's right. When we launched the company in the latter part of 2011, we actually got an overwhelming response rate from family caregivers. We believe that they are actually our targeted consumers of our subscription service for aged loved ones. A lot of the folks that contacted us said they had a loved one that they cared for, are worried sick about, they need a helping hand, and they really felt like our service was appropriately priced at less than 10% of the typical cost of assisted living.
And which is very expensive, frankly, as time goes on. And, you know, you're more comfortable in your own home. And, you know, as you age, all of the memories that are there, and it can just be heartbreaking because I've seen it before being, you know, taken out of that home, out of that environment. So you're giving them the tools they need in order to stay a little bit independent. Now, how does this work here? Do people go sign up at virtualhealth.com and you're providing some of these tools? And I assume there's guides and ways to help people understand what's happening.
Sure. What we're promoting is a lifestyle choice. So some of your listeners may want to come up to the virtualhealth.com site. What they would do is they would basically fill out a contact us form, in which case we would take some of our member services organization as well as our clinical providers to do outreach to that patient or to that family caregiver, explain to them the service. Then we would go out and do an outreach to their seniors' primary care physician. We feel that it's really important to keep that PCP engaged as part of the overall senior's health. We offer, as part of our cost structure, the reimbursement to that physician to develop what's known as a plan of care. So this is the game plan to make sure that mom is able to stay at home and be well. Then we'll take technology solutions developed by Intel GE Care Innovations, and we, on our side, would have virtual health installers that are trusted installers that we've trained come to the home, explain to mom how to use some of the medical devices, which is in effect an ATM-like experience using a touch tablet. So no keyboard, no mouse experience. As part of that solution, it includes a video conferencing capability to keep the patient engaged. And then we have our care coordination staff that we would partner with, whether it's be a senior bridge care coordination nurse as an example, channel partner, or potentially it's somebody else. It's a physician private practice, a concierge physician group from American Association of Private Physicians that have partnered with us. And they would be responsible for making sure that the vital data, blood pressure, weight scale is all within trends. If not, then the escalation would occur up to mom's physician.
All right, well, that makes a lot of sense here. So you can really help out. You know, I'm looking at my parents aging here. I just lost my grandmother, who was well into her 80s. And I saw some of the transitions going on there,
Sure.
seen with my parents who are approaching 80 as well. And it's just not a pleasant thing. So being able to have an organization, again, like Virtual Health, that can come in and work with all of these providers and work with the family and work with the elderly makes a huge difference.
Certainly. We're here to go make it really easy for family caregivers and seniors to remain independent at home. We offer a product that is 1/10 of a typical cost of assisted living. And as you know and may have known, that assisted living in the U.S. can vary from $3,000 a month to about $6,000 to $7,000 a month, and that's all out of pocket in many times. So we're here, we feel like with our network of providers, partners, as well as the technology that we've standardized on, we feel like we have an opportunity to promote that and enable that senior to remain at home.
All right, I appreciate you being with us. We've been talking with Alex Go. He's CEO over at Virtual Health. You can find them online at virtualhealth.com. When we come back, we're going to be talking more about some of the latest technologies right here on Tech Talk with Craig Peterson. Stick around. Thanks for watching another Tech Searchlight, brought to you by Tech Talk with Craig Peterson. Visit us online at craigpeterson.com.